So the folks from Seaside Therapeutics, along with Rondi Hagerman and Liz Berry-Kravis, who were involved in designing and executing the protocol, presented some of the preliminary analysis of the data from the R. baclofen study. And it did show, in a double-blind, placebo-controlled trial, statistically significant evidence of therapeutic effect. However, the data were, like I said, very preliminary, so they only had some of the measures available. It was a little bit difficult to interpret just early on, but so far so good. People were certainly very excited about the fact that clinical trials are underway, and immediately before this meeting, there was, of course, a New York Times article by Gardner Harris that talked about Fraxa's efforts, as well as the Novartis trial. They completed a phase 2 trial in adults with Fragile X in Europe, and we'd heard through the grapevine that it had gone well, but nobody has actually seen any data from this so far. They're not required to release this information. We were all very excited about this, obviously, but the reporter for the New York Times actually managed to get folks from Novartis to say that, yes, it was a positive study and we're proceeding with plans for phase 3. So that was very exciting. So when Seaside presented their data, I think there was the sense that there's kind of a groundswell, and the trials are really taking off. But one of the things that they did find in their study is that they had a very high placebo response rate, and that's always difficult for Fragile X and special needs populations in general. You do tend to have, even in pediatric populations, you tend to have a much higher placebo response rate than you have in trials in adult psychiatry. And that can really mess up the results. It makes it very difficult to figure out what's going on. If placebo works really well, then it ends up being much more difficult to show that your drug works better than placebo. In diseases and in populations where you have a low placebo response rate, you usually have an easier time demonstrating therapeutic effects. And in particular, the folks at Seaside had mentioned that they really saw a lot of scatter in the outcome measures. So, in other words, some people would respond with a very high score on a particular rating instrument one time and a very low score the next time. And that's the kind of thing that just drives people crazy when they're trying to do clinical trials, because it means that people just are not responding appropriately. Now, obviously, in this case, they weren't getting these ratings directly from the Fragile X patients, who probably weren't capable of giving consistent ratings, but from the caregivers, mostly parents. So that makes things a little bit difficult, and I think that raised a lot of eyebrows all around, especially because it was followed immediately after by a presentation by Carlo Parabello from the Fragile X Research Foundation of Canada, and he discussed the minocycline trial that Fraxa funded, and Carlo and I were co-authors on the paper, and we organized that together, and we're pretty enthusiastic about minocycline. Let's just say that neither of us has any doubts that it is a really useful treatment for Fragile X, but it's important to show this in a clinical trial, because other physicians out there need to have some rationale for prescribing something other than just, some guy on the internet said it worked. That's not good enough in medicine. You do have to have some evidence, even if it's an established drug, even if it's something that's available and is known to be safe. So the open trial that Carlo did showed very positive effects from minocycline in Fragile X. A very good treatment response, very robust effect. He had a patient population that had moderately severe symptoms of Fragile X, and they had a pretty big decrease when they were treated for 8 weeks with minocycline. The one downside to the trial is that he did note that a surprisingly high percentage of the patients showed a small uptick in the indicator, the lab test that they used to detect autoimmune disorders. This is the anti-nuclear antibodies is the term for this test. So they do a test of, they look at your blood to see the concentration of these anti-nuclear antibodies. And there was a small increase in about a quarter of the patients with Fragile X who took minocycline. Interestingly, these were asymptomatic. Nobody actually had any problems with this. And in fact, the study involves a long-term continuation phase. And even with long-term continuation, nobody had any obvious clinical evidence of autoimmune disease. If you actually look to see approximately how many people have this sort of response in the general public when they're treated with minocycline, well, the answer is nobody really knows because nobody's ever really tracked it this way. This was something that was done proactively at the request of the ethics panel in Toronto, and in retrospect, it was a good idea for them to suggest that. Now, we're not really sure if people with Fragile X are more susceptible to this sort of thing or if it really means anything. We've had a few people in general use develop autoimmune problems with minocycline and Fragile X, but it's just been a tiny fraction that's in accordance with the figures that you usually hear of 1 in 1,000, 1 in 10,000 people who take it will get these autoimmune responses. So it's fairly rare. But it looks like these minor things are maybe not so rare. And the question is, what does it mean? Is this clinically significant? And right now, we don't really know. And we're going to be consulting with folks and following along with some of these other people who've been treated long-term with the drug. So we'll be investigating that. But in the meantime, at least within the limitations of this study, because it was an open trial, so far so good. Looked pretty good. Following that, Jonathan Picker and some of his colleagues from Children's Hospital in Boston talked about their efforts to use transcranial magnetic stimulation as a kind of probe to see what's going on in the brain. And this is a technique that can be used therapeutically, so psychiatrists are using it as an alternative to electroconvulsive therapy or electroshock. But it can also be used as a kind of passive way of getting some indicators of, say, long-term potentiation or correlates thereof in the brain. So you can non-invasively just kind of see what's going on in somebody's head by putting these big magnetic coils and just looking at the magnetic fields. And they're starting to get some data from their experiments, but it's not really clear exactly how we're going to use that yet. So we'll just have to follow along and see. It would be interesting if you could do something like that, because this doesn't involve putting you in a giant MRI scanner or a PET scanner. It just involves taking a little hand wand and putting it next to your head, and that's the sort of thing that people with Fragile X could definitely tolerate. So I'm going to leave the rest of the discussion for the next tape. I'll see you in just a bit.